All right. Hey ho, let's go. This is Resistance Radio, where natural selection selects resistance and where bad policy keeps breeding the same preventable disasters. Today, we're talking about contaminated lettuce, measles, Ebola, and tick borne illnesses, as well as flu vaccines. Then, what it means to have a CDC director who can actually say no. And finally, what Florida's so called leprosy story really tells us about stigma systems, policy, hint is part of the pathogen's environment. Now we move on to this week's public health headlines. First, Cyclospora outbreak tied to recalled iceberg lettuce from central Mexico. Michigan reports more than 11,000 outbreak related illnesses, 193 hospitalizations, and 2 deaths in people with underlying conditions. A salad should not require an epidemiology degree. Tracing one ingredient through the food chain has been slow. Where traceability is weak, the public becomes the early warning system. The weakest link is usually the person with the least room to absorb harm. Now, measles tells us the same story in a different language. The United States has logged more than 2,300 cases this year. My goodness, it's a preventable disease. All right. That means babies who are too young to be fully vaccinated, families missing work, and public health teams chasing a virus that vaccinations can prevent. 3 probable tularemia cases in Suffolk County remind us that rabbit fever is rare, but ticks and wildlife do not follow our preferred news cycle. And flu vaccine data has offered us better news. Vaccinated people had about 1/3 fewer medically attended outpatient illnesses. Now, 1/3 is not magic, and it was for last season, but it is one fewer sick person out of a total of 3 who might otherwise need care. Prevention rarely gets a parade, but it does keep people out of the emergency department. And for our final story of our news roundup, in Eastern Democratic Republic of the Congo, the Ebola has grown devastatingly large. The virus is dangerous, so are delayed detection, conflict, and strained health services and workers asked to do more with too little. Ebola control requires community trust, local leadership, protective equipment, labs, treatments, and vaccines. None of that appears by wishful thinking after the first missed case. Outbreak response is infrastructure built before the dark. So let's move on to the new CDC director who was just voted in on today's date, which is Wednesday, August 5th. Her name is Dr. Erica Schwartz. Her credentials are very good. They're very serious: medicine, internal medicine, public health service, senior federal leadership. But the director's job is not ceremonial. The CDC turns surveillance into warnings, science into public guidance, and resources into support for health departments. When the agency speaks clearly, clinicians, parents, and schools can act. When it is muzzled or confused, misinformation fills the space like floodwater. Public trust is built in advance and spent in emergencies. That's why her confirmation hearing really mattered. Senators from both parties pressed Dr. Schwartz about vaccines, scientific integrity, and whether she could resist political interferences from HHS leadership. She said that she would never betray or compromise on the science, and that is the right promise. But some senators wanted a more direct answer about defying an unscientific order after a previous CDC director was removed amid vaccine policy conflict. So we will need Dr. Schwartz to be clear, not merely careful. The public needs a director who can tell a superior no. The evidence does not support that. Science without independence is really just a press release. So we will hope that she will do the right thing moving forward. And I will certainly report in this space here if she does not. Lastly, we're going to move to Hansen's disease in Florida. That is what people call leprosy. Florida recorded 36 cases in 2025 and 17 more by mid-July this year. That is a large increase, and it's clinical awareness in Central Florida. But it's not evidence of a national sudden, of a sudden statewide outbreak. Hansen's disease is actually a bacterial infection that can infect the skin and peripheral nerves. It is treatable and it is curable. The real danger is delayed recognition and nerve damage. Fear travels faster than bacteria, but facts can catch up. The clinical cues are often very quiet. A persistent light or reddish skin patch with reduced sensation, numbness or tingling in a hand or foot, weakness, or even enlarged tender nerve. The bacteria grow very slowly, so symptoms can emerge over years. Transmission usually requires prolonged close exposure to untreated infections. In Florida, for example, in contact with armadillos or their environment, which may matter in some cases. Treatment uses a combination of different antibiotics, and early care helps prevent disability. So the message is neither ignore it or run for the hills. It is recognize it, treat it, and leave the stigma to seriously to last century or even several centuries ago. A diagnosis is a doorway to a care, not a verdict on a person. So, taking these stories all together, Cyclospora in our salad bowls, measles in waiting rooms, Ebola in conflict zones, tularemia in woods, and leprosy in Florida, and the politics all around the CDC describe basically the same pattern. We underfund the basics and then act shocked when the basics fail. Public health failures are public policy failures when protection and information pool around the well connected. It's low income communities, it's the immunocompromised, it's workers, and it's countries with weaker health systems that take the hit first and hardest. Outbreaks do not come out of nowhere, they walk through doors that our decisions leave open. So, this is Resistance Radio, where natural selection selects resistance, and public policy decides whether that resistance shows up as shared protection or as communities forced to tough it out alone again. Thanks for tuning in. I'm Mark Allendary.